Bladder cancer is the 10th most common cancer globally, with more than 500,000 new cases every year. With an expenditure of $9 billion every year, it is the most expensive cancer to be treated. Small bladder lesions, in particular lesions that are flat, are not detectable by the conventional diagnostic imaging techniques. Therefore, these lesions are not removed by the surgeon. Furthermore, the intravesical therapy that follows the surgical intervention is effective in about 50% of the patients. As a consequence of the limits of the current diagnostic and therapeutic approaches, the same individual undergoes tumor relapse, thus to multiple diagnostic imaging, surgical interventions and therapies after the first diagnosis, which have an important impact on the quality of life of the individual and on the national healthcare systems. The EDIT project, funded by the European Union's Horizon 2020 Research and Innovation Programme, bringing together expertise in the fields of biology, biochemistry and urology, chemistry, ultrasound and photoacoustic imaging, anatomical pathology, mathematical modelling and software development, with the aim to introduce an innovative approach for the detection and the treatment of small bladder lesions below 0.5 millimeter size. The proposed approach is based on the intravesical installation of engineered gold nanorods, which, acting as contrast agents, allow for the identification of tumour smaller than 0.5 millimeter by photoacoustic imaging. Gold nanorods are then overheated by laser light until the thermal ablation of the tumour is reached. In the project context, an innovative software allowing the automatized 3D imaging reconstruction of the bladder by overlaying ultrasound and photoacoustic imaging has been also developed. As further result, a mathematical model able to estimate the efficacy of the photothermal therapy provided by the amount of gold nanorods bound to the tumour has been introduced. The technological innovation provided by EDIT represented the prelude for clinical application toward reduction of bladder cancer relapse, reducing national healthcare costs while improving the quality of life of millions of people.